Do you know that 45 to 50% of Nigerian women of reproductive age are affected by uterine fibroids? This indeed is a major public health concern. Today in our series of What You Need to Know, an obstetrician and gynecologist in FUTH Lafia will walk you down what you need to know about uterine fibroids.
My name is Dr. Steve Okoro. I'm a gynecologist working at Federal University Teaching Hospital Lafia. Today I'll be talking about uterine fibroids. So what are uterine fibroids? Uterine fibroids are non-cancerous growth of the muscle of the uterus, which is also called the womb in colloquial language. And they are pretty common as 8 out of every 10 women you see on the street of reproductive age will have uterine fibroid. Like I said, they are non-cancerous, so they are benign and they occur pretty commonly. What causes them? Nobody knows. However, there are certain things that we know that can make a woman more prone to developing uterine fibroids. And one of those things is the ethnicity. So a woman of black race has a higher chance of having uterine fibroid in her lifetime compared to other ethnicities. Also, things like being obese. Obesity also increases the risk of having uterine fibroids. Female hormones like estrogen and progesterone have also been known to be associated with a woman developing uterine fibroids. How do women who have uterine fibroid present? Commonly, they present with heavy menstrual bleeding. So if you see yourself having lots of heavy menstrual bleeding or having recurrent pelvic pain, especially during your periods, and also you may also notice some swelling around the abdomen, it may suggest that you have uterine fibroid. How do we confirm this? Is by you going to your doctor and laying these complaints. Your doctor is likely going to ask you to do an ultrasound scan, which will show evidence if you do have this uterine fibroid. Now, these uterine fibroids, they can be as small as a seed or as big as a watermelon. All right, and they can occur singly or they can occur in multiples. How are they treated? So the treatment of uterine fibroid depends on the size and the symptoms which the patient presents. So if the woman does not have any symptoms, as most uterine fibroids actually will present, she does not need treatment. However, if it causes her symptoms such as heavy bleeding, or it causes her pain, or it affects her ability to have children, that's if the woman is being treated for having any fertility treatment, then you may offer her treatment. What are the treatments? We have medical and surgical treatments. Now, the medical treatments basically just treat the symptoms, which I've mentioned earlier, that is heavy bleeding and pain. So if a woman comes with fibroids, has heavy bleeding, has heavy pain, your doctor can give you medications to take care of this. Other than that, when definitive treatment is required, surgery is what is indicated. Surgery that we call myomectomy, which is a surgery to remove the fibroids. Or for women who have completed their family size, it may require removing the womb entirely. That's for women who are older or have had the number of children that they wish to have. Now, there are common myths that people have concerning uterine fibroid, and one of them is that you can take herbal medications and the uterine fibroid disappears. This is actually false because evidence have not shown that there are medications that can actually treat the fibroid. You may have medications that can shrink it for it to be easily removed by the surgeon, but there are no medications that cure uterine fibroid. Surgery is the definitive treatment for uterine fibroid. The other myth is most women fear that once they have surgery for fibroid, that it reduces their chance of having children. This is actually not true, because even studies have shown that 6 out of 10 women who have surgery for uterine fibroid who are not able to conceive initially are able to have children in the following 1 year of life. In the following 1 year following the surgery, right? So it is a myth to say that after surgery a woman doesn't. Bear in mind that most women who come to have this surgery already have issues with bearing children. So there may actually be other causes that is preventing them from having children other than the fibroid itself, so that we don't blame it on the surgery after the woman has surgery. Another concern that women have is about the surgery itself, the general fear that people have for surgeries. But you must know that in the Federal Teaching Hospital Lafia, we have an obstetric department, a gynecological department, that have a team of very senior consultants who are experienced in doing these surgeries. In fact, I can say that we have a record of carrying out at least 3 to 4 myomectomies per week in this hospital, and most of our patients go home without any complications. So what is the take home? The take home is, if you find yourself having any of these symptoms I've mentioned, heavy bleeding, pain during menses, or pressure symptoms like frequent urination, constipation, and you should actually consider seeing your doctor so that the treatment can be offered to you. Thank you.
Wow!